virus outbreak. That briefing should start momentarily. But in the meantime, some updates. South Korea's top office has expressed strong regret over Japan's decision to tighten its entry regulations against South Korea. The National Security Council convened this morning, and officials agreed to consider what reciprocal measures might be necessary. They said the Japanese government, without consulting South Korea, has taken action that is unreasonable. Tokyo announced Thursday that it would quarantine people arriving from South Korea for 2 weeks. The NSC added that South Korea is strictly managing the situation through its scientific and transparent quarantine system, while Japan is losing the trust of the international community because of its passive response to the virus. And Prime Minister Chung Se-kyun is calling on Tokyo to immediately retract those measures. Seoul's foreign ministry was also set to summon Japan's ambassador to South Korea today to lodge a formal complaint. Oh Jung-hee reports.
South Korea says that extremely regrets Japan's decision to tighten entry restrictions on travelers from South Korea and is strongly urging Tokyo to change its mind. In a text message to reporters on Friday, Seoul's foreign ministry said it cannot help but question whether Tokyo has other intentions.
코로나 바이러스 감염증 일부 국내 발생 현황을 말씀드리겠습니다. 3월 6일 0시 현재 총 누적 환자 수는 6,283명입니다.
COVID-19 confirmed cases stands at 6,284. Of them, 108 have been discharged.
518명이 증가를 한 상황입니다.
So this is up by 518 compared to a day before. By region, the Daegu region has seen the largest number of accumulative patients with 4,693. And in Gyeongbuk region, we also witnessed a great increase in the patient number. And the total number of the patients combined in Daegu and Gyeongbuk account for 90% of the outbreak. And about 77% of the outbreak are related to cluster transmission. And we are currently looking into the 23.3% of the sporadic outbreaks. And by city and provinces, we see sporadic outbreaks, and please refer to the table which is enclosed in the press release. And in Gyeonggi-do province, we currently have confirmed that 9 cases have been confirmed in Bundang Daeseng Hospital, and they range from patients to medical members, and all of the contacted people are on self-quarantine. And in Daegu, relating to the Shincheonji Church, it accounts for 72% of the total number. And in this investigation, we found out that cluster transmission is currently taking under place, centering around social service facilities. And in Gyeongsan, the outbreak is currently occurring centering around Honghwa Purun Sanatorium as well as other welfare facilities. And in Cheongdo Daenam Hospital, there was another sanatorium, and we have witnessed 3 confirmed cases. 2 of them were patients, and 1 of them were the medical staff. And this medical center has also been quarantined, and we also later found that the 3 people have tested positive. And currently we are investigating into the case. And the headquarters of the KCDC headquarters currently is exerting our full efforts to curb the further spread of the COVID-19. And aside from them, we are witnessing cluster infections. And in order to curb the further spread, we ask for your cooperation in all regions. And each of the local governments need to have an emergency network, emergency contact network, and needs to carry out swift quarantine as well as epidemiological testings. And especially for social facilities, we need to identify as soon as possible the confirmed cases, and we need to look into and trace their movements. And these are the first crucial measures that need to be taken swiftly. Currently, thanks to the local government's initial efforts, we have been able to curb the further spread of the social spread of the virus. However, we need to exert our efforts even further because the virus outbreak is currently continuing on throughout the nation. And each of the facilities need to have designate a person who is in charge of making the contact list so that this person can be responsible to contact the central government whenever a case is reported. And all of the people who work at these social facilities need to abide by the personal sanitary measures, and if needed, we need to check their body temperatures twice a day. And if you have any, if those of the people working or the users have any symptoms of respiratory symptoms or fever, they need to stay home for a couple of days, and they need to look at their conditions for 3 or 4 days. And moreover, those who are responsible for looking after these facilities need to urge and suggest these people to stay home and not come to work. And recently, we have witnessed the transmission through community centers, including the karaokes and PC rooms. And these centers need to have a great amount of soap and hand sanitizers, and they need to also have regular ventilations. And the CDCH, regarding the compliance of the personal sanitary practices, we strongly believe that we can curb the widespread of the virus. And washing of your hands, coughing etiquettes are some of the basic rules and measures that need to be abided. And starting from tomorrow, we will have the weekend. And during the weekend, we suggest that you stay home, and especially if you need to stay away from people who have respiratory symptoms or fever, and you need to avoid going to crowded places and closed places like the religious activities. And when you are staying at home, please take good, sufficient amount of rest, and you need to work out. Small amount of muscle exercise and cardio exercise is very important to prevent these infection, and regular ventilation is also very important. If you have fever or respiratory symptoms, do not go to work or school, and don't go outside, and stay at home for a couple of days and monitor your own conditions. And that's all. Thank you.
Speaking there was Chung Eun-kyung, the head of the Central Disease Control Headquarters. And that concludes our live coverage of this briefing. In our upcoming newscasts, though, we will have updates on all this information along with some in-depth analysis. Stay tuned to Arirang News for all the latest on the coronavirus outbreak. We'll be back in less than an hour at 3 p.m. Bye for now.
The novel coronaviruses are spreading all over the world. To prevent the virus from spreading further, it's essential to attend to personal hygiene and take preventive measures. Rule number 1 for preventing the infection.